It is going to be a fun hour today. I get to lecture with Karol Biami, who is a dentist from São Paulo, Brazil, and which I love São Paulo, Brazil. I've lectured there 3 times in the last 20 years, and it was also the largest lecture I ever was honored to give in my life. 4,000 dentists in São Paulo. That was the year 2000 at the Aesthetica 2000 conference. Oh my God, I had a blast. I don't want to say anything mean, but I think I do like Rio a little better. I always, every time I lecture in São Paulo, I'd go spend 2 or 3 days in Rio before I went back. What is it called? Copacabana?
Copacabana, yes.
Copacabana?
Yes, yes.
Like the song by, who sang that song? Copacabana?
Tom Jobim. And here in America, Frank Sinatra records with him.
Yeah, that beach, I mean, I don't know how long that walk is along that cove from one end to the other.
Actually, the music is not from Copacabana. It's the girl from Ipanema.
Yes,
the beach in the sides of Copacabana. Yeah.
Oh my God! And that is got to be, if there is a paradise on earth, it is Copacabana Beach. and I want to tell everybody, all the men out there watching this video, that all the women on the beach on there are almost as good looking as you are. It's
thank you.
It's the biggest collection of beautiful people I've ever seen in my life, and the atmosphere is fun, and Brazil is just, compared to America, it's just so more laid back and relaxing and fun and non-judgmental, and they just don't seem to be uptight at all.
I think we value a lot their family and good time with friends and family. So for us, it's important to work, of course, but it's important to also you enjoy. It's like work hard and play hard.
Yeah, and little nuances I picked up. Like a lot of the dentists there, they don't wear watches because they're not obsessed with they got to be back at the office in 3.1 minutes to seat their patient exactly on time. I mean, if they're finishing up lunch, and they'll just jolly, lazily, stresslessly go back, and it just seems to be so much less stress and so much more happiness and
it's like our lunchtime, for example. We sit down with your family and eat. It's not like here. I learned here to be like an American girl, but it is definitely a different culture. But you know, Howard, there's no right or wrong. I would say to you that a balance would be the ideal. I love America. I love this country. I'm a citizen now, and I chose this to be my where I'm gonna build my life. I do miss Brazil, but here we're doing great stuff, especially when we talk about dentistry. It's awesome.
Now, is your husband from Brazil too?
No, he's from Chicago, Illinois.
He's from Chicago, so you don't are you losing your Portuguese now that your husband speaks English?
I can lose my Portuguese, but my accent seems getting stronger every day.
So you moved to Florida, which I think is just genius. How Florida is the only state that lets a dentist from a foreign country come be a hygienist. We have hygiene shortages in many rural areas. I know dentists in small towns that have had ads out for hygienists for 5 years and no one's applied. And there's dentists in their city that were trained in India or Brazil or Russia or Czechoslovakia. And I did that. Kudos to Florida for doing the obvious. So then you came to America. You were a dental assistant in Chicago, and then you became a hygienist in Florida. And now, after seeing all these offices, you're breaking out into dental office consulting. So tell us what made you interested in dental office consulting, and what are you bringing to the table with that?
Okay, well, after we start that, I'm going to tell a little bit about me. I come from a family with 12 doctors, 12 dentists, believe it or not. So I would say that dentistry is in my blood. And, I didn't have a lot of choice wanted to choose to be my profession. So I've been in dentistry for 13 years now. I have 5 years as a doctor in Brazil, 3 years as a dental assistant in Chicago, and 5 years work as a hygienist. And since then, I've been also, like you said, I've been going to a lot of dental office and helping a lot of doctors and dental hygienists increase their productivity, increase their level of patient care, and profits as well. I feel that I have a 360 view of the dental practice, and that gave me a lot of baggage to be able to help hygienists and doctors place systems and protocols in place to, make their hygiene department rise and be very productive.
Now, my thinking on dental consultants is I've been telling consultants this for years that a lot of them don't want to share what they do because they think the dentist is going to learn it and then not need their services. And I think it's the opposite. I think most dentists, when they pick a consultant, I say, well, why did you pick this one? And they say, well, this one, here's their menu, what they do, and here's what this person does. Like some want to come in and drop all your insurance and turn you into a cosmetic boutique spa. And they're just like, that could be right or wrong. They just don't want to do that. And then this one, maybe their area is insurance or HR or whatever. I think the more transparent the consultant is and says, this is what I do, then the dentist looks at it, because what I think the dentist is actually buying is the dentist knows that he or she's not getting it done. So I'm not giving you money because you know something that I don't know or can't understand. It's just that I just can't get my team to do this. And a lot of times when a outside person comes in, they're more accountable to you than the dentist that they've been working for 5 years, who they know is easygoing and is just going to be a rollover. So tell us your menu. So if I'm a dentist out there in America, what would you do for me? So let's just say I'm in Wichita, Kansas, and my office is flat. Obviously the economy since 2008 has not been, that was the biggest recession we ever had. My office is flat. It's not going down. It's not growing. Basically it's malaise. It's apathy. Okay. So I want to bring in Karol for a fresh shot of energy. And what would you do for my office?
Well, first, Howard, I'm going to talk with you to know what you believe, what is your philosophy, your culture, what you want for your office. A consultant can go in, but if they don't work with your desire, what your vision is, doesn't work. So I would sit down with you first and ask what your goals, what you would like to accomplish, and what your hygienist and your dental assistant would do for you to help you out. So after that, we got to talk with the team also, and make sure that the team and the doctor are on the same page. That's, I think, is the bigger trigger. I go to dental office where the hygienist like one thing, the doctor like another thing. I feel like there's a gap between hygienists and doctors, where sometimes doctors are ready to start a protocol and implement systems in place, but hygienists don't really feel that is the right thing for her. Or vice versa. Sometimes the hygienist is ready, she want to work with the consultant, and she want to provide better care for their patients, but the doctor has some resistance. So I would tell you that the first thing I would talk with the doctor and the team. I believe that they need to be on the same page. Once we get to a point, a common goal where everybody agrees, then we're going to see what's going on. We're going to see what you're doing right now and how can we improve that.
And Karoline, if we were talking in America, football, or in Brazil, soccer, and obviously when you were in Brazil and you were analyzing and you were going to consult a soccer team, you would focus on, do I have the best 5 soccer players on the field? Right. And you wouldn't be talking about the stadium, the ball, the grass, whether it was natural or turf, or the uniforms. You would go right after the players. Right. And you would go in there and you'd say, we need to get this player from another team and we need to get rid of that player. When you go into an office, how do you evaluate if I've got the best 5 soccer players in my office? And how do you make these tough calls that, no, this soccer player is never this isn't a goalie. And we need a better goalie. How do you make those calls? Because do you believe that the players are the most important part of the office team?
Definitely. There's no success for the doctor if we don't have a good team. The team can make or break the doctor, I say. Definitely, I think the first thing it is analyze numbers. Numbers are extremely important. Numbers don't lie. So we can go, for example, in a dental hygiene department and analyze the numbers. And also see who is really on board, who is the hygienist that don't mind to stay half an hour late if it's necessary, don't mind to skip the lunch that day if it's necessary. And like see also who has a good feedback from the patients. If that one has a caring touch, that one is focused on educate and give information to the patient. All of that is extremely important. But you know, I'm not. I feel that everybody should have a chance. A consultant can train and develop some skills in your team that I believe should be the first move. And then, of course, if you see that you gave opportunities, you are investing in your team, and they are not giving anything back, then you need looking for other players to be in your team.
So give some red flags. A lot of dentists tell me, you know, probably the most common question I get is, I've had this staff person for 5 years. Okay. And I'm just not sure if I should keep trying or let her go. How do you come in on the outside versus the dentist who's been with this assistant receptionist hygienist for 5 years? How do you come in the outside? What are you looking for to decide, you know, should I stay or should I go?
I like first personality. I think you need to have in your team people that believe in what you believe and people that give their blood to make it happen. Doesn't matter what happened. You need put all your effort to help the dental office and give the best care for your patients. So I would say personality, attitude is extremely important. Other thing that I think is important to see how professional that person it is. How is your hygienist acting even outside the office or with your patients? Does she respect you? You know, there's gossip around. So we should not have those things. I always tell, leave your problems in a door, outside the door. When you walk in, it's all about be the best you can for your patients, have the best customer service and the best treatment. Focus on do the right thing for your patients. As far as hygienists, also Howard, it's very important to hygienists that know how to diagnose and treat periodontal disease. I say that because a lot of offices in America are losing opportunities because of that. Losing opportunities to do the best for our patients and opportunity financial also to make profits. So you don't want to have those hygienists that want to clock in and clock out to be a profi machine, I say, those bloated profis, and go home. No, you want someone that is interested in learning more, is interested in really diagnose perio in conjunction with the doctor, and that has good attitude, you know, help remove the garbage in the end of the day. If there's no patient, help go to the phone and do some recare calls, help the dental assistant. I don't like those queen bee hygienists, you know, like really do whatever it takes. And for me, actually, that was easy to learn. Even I have my experience as a doctor in Brazil that gave me all that knowledge about the business side of dentistry. That we have payrolls, we need to pay people, we pay the rent. And then coming to America and work as an assistant gave me that, okay, I'm not a doctor now. I need to follow the doctor. It gave me an understanding on how important it is be a team player. A dental assistant needs to be the best, I think, in the dental office and really follow that command from the doctors. And have those systems in place, like what a consulting company can bring it to you, help the assistant be able to think one step ahead of the doctor. And as a hygienist, I learned that caring part of dentistry and the education is extremely important. You inform your patient, educate your patient about what's going on with them, and then I guarantee to you, Howard, they will accept more treatment, and then you notice that you care, and will become loyal patients for you and refer more. But before you get to that point, definitely you need to have a team player, someone that give her blood and soul to the dental office. It's not there just to clock in or clock out, but to be serious and remember why she become a healthcare provider.
Yeah, and I dentists' big complaints are, a cancellation in the hygiene department and then an emergency patient that needs to be seen today. And don't those things balance each other? And when I tell dentists, well, if your hygienist got a cancellation at 10 and you got a toothache, we'll schedule with her. She has 4 years of college. She can take a PA and a bite wing and diagnose everything and get it all ready for you. And dentists just routinely tell me my hygienist won't do that. And I'm like, well, then why did she go to school for 4 years? What was she? I mean, like I say, we're a fireman. And you put water on the fire. It doesn't matter if it's a toothache, periodontal disease, a 2-year-old prophy. I mean, you're a healthcare provider.
Exactly. And I like the words a lot because healthcare provider for me means health, bringing back the health for your patient, take them out of pain, bringing their confidence back by beautiful smiles. But also the care means take the time to inform, to educate your patient about what's going on. So in the case like you just described, yes, if the hygienist has a chair available, please, why not? Take the x-rays, start to review the medical history, see if there's any connection between what the patient is having in his mouth, which any medication that he's taking, or any pre-existing factors that may be causing that problem. So, and be a bridge. I believe the hygienist should be the bridge between the doctor and the patient. I think it's so awkward for doctors walking in a room and the hygienist don't say anything. So hygienist should warm it up everything and tell the doctor what her finds and tell also her opinion, what should be done with that. But I feel that there's a lack of communication. And there's two parts on that, Howard. Sometimes the doctors can maybe not explain to the hygienist what they want. So it's very important the doctor be the leader. The doctor leads the conversation. And the doctor starts telling the hygienist, I would like this, and that. And it's very important for the hygienist understand what the doctor wants. And if she don't know, ask, explain to the doctor, it is that, I'm doing right. And I believe that a consultant can bring that, open that dialogue between the doctor and the hygienist. And like you said, when we listen from somebody else, it's always more powerful than from the ones that talk with us every day.
I feel sorry for the hygienist whose doctor keeps her handcuffed by not letting her point things out on the x-ray and say this tooth, needs to be extracted. It can't be saved. This one, you could either do a root canal or extract. I mean, it's like they got 4 years of college. And if they were 4 years of college and became a registered nurse, they're in the hospitals giving shots, starting IVs, dispensing medication, and then they go work in dentistry. And if they work for someone like me, I want them to do all they can because they're in there for an hour to communicate with the patient. Yes. And I would say 2/3 of them are handcuffed by their dentist. They're not allowed to take x-rays unless the doctor diagnoses and says, oh, yes, you can take an x-ray. They're not allowed to just look at that and say, I need an x-ray. They're not allowed to say, I mean, it's just crazy.
Yeah, I think the hygienists need to take more, empower themselves to really feel confident about doing things, even if it is something that they need to maybe communicate with the doctor before. But the hygienist has a big role in the practice. So I would say, talk with your doctor and tell them, look, I can take x-rays and I can make your life easier by maybe anesthetize a patient for you if it is a stage that allows hygienists to give you local anesthesia. For example, Florida is everything happened here so late, but 2 years ago, we are allowed now to give also local anesthesia to the patient. So help the doctor. If the doctor is running behind, do you need anything, or the assistant? And really be proactive on things. I don't like micromanagement. I don't think it's good for any one of us. So I would say it's all about the conversation, Howard. And hygienists tell what she think will be the best for the practice and the doctor also, and they come to a conclusion. And remember, we are a team. We are not against each other. We work in the same team to bring good results for our patients.
Yeah, and I wish all healthcare providers like that. Like you go to the pharmacy and the pharmacist can give a vaccine and vaccinate grandma for the flu. But here I got grandpa, and he hasn't been to any healthcare provider in a year, and he's in my office. I can't give him a flu vaccine. You know, a registered nurse can give you an HPV vaccine in the hospital, but I'm a doctor, and HPV is a cause of oropharyngeal cancer, and I'm not allowed to discuss the HPV vaccine and give it to the patient in the chair or the hygienist. So, yeah, the government, I mean, I know they're trying to regulate and protect the public, but a lot of these regulations cause more harm than good.
Yeah, no, definitely. And I feel that the regulations between professions like hygienists and what hygienists can do or not, because we are such a big country and we end up having different rules for each state, can become a little difficult for the hygienists as well. But I would say, for example, you just mentioned illness. If the hygienist is in the office, she is the front line, for example, to fight periodontal disease, in my opinion. So she did start the conversation with patients about it, and don't just let the doctor come in and start to work in a veneer, in a bloody gum. You know, it's not gonna work. One of those reasons that I say that is because I work in Brazil as a doctor, and I remember how it's important the perio health. So I could do a veneer, so I could do a nice implant. You understand? And I see that there's not a connection. Hygienists didn't got the point to understand, to connect the dots there. For example, Howard, it's an epidemic what happened here in America and in Brazil too. CDC says that 50% of the Americans over 30 years old has periodontal disease. Academy of General Dentistry says that 80% of the population in America has a type of gum problem. That includes periodontitis and gingivitis. So I feel that the hygienists sometimes close their eyes and start doing those bloody profiles, and they need to really start a conversation with the doctor and with the patient and tell, look, we need to address that to our patients, because there's the whole mouth and body connection that we know today that this can affect cardiovascular diseases, diabetes, pancreatic cancers, and premature mothers that are pregnant and end up having premature babies. All that can be aggravated by gum disease, by perio. So definitely, I feel that is an opportunity there through the dental hygiene department to connect the doctor, the patient, the hygienist, and not only do the best for our patients, but increase profit, be more profitable, increase definitely production in the dental hygiene department. And that's the hygienist need to understand that business part of dentistry. She's not there only to clean teeth, but to participate, to engage the patient with the doctor, to find a crown that has an open margin, to find a broke filling, and really refer to the doctor. So it's a win-win situation.
I would say, I've said this for years, that if I could just one word of one trait of the most successful, not only dentists, but any business owners, it's always been humility. It's always been humbleness. A company, I don't care what you make a product and your customer complains. 90% of people don't want to hear it. If you post a bad review on Google or Yelp or whatever, they want to get an attorney and sue you and take it down and all this. But the humble ones are the ones that are saying, the humble dentist listen to the hygienist. The humble dentist listens to the assistant. And so many dental labs tell me they can't call their dentist and say, wow, this is a horrible impression. You need to retake that, and you need to manage the gums better, and you should get an ADM laser, or you need, because if they say that, the dentist is going to tell them to go fly a kite, and then he's going to lose a $5,000 a month customer. And it's just humility to just walk in a room and respect your hygienist or your assistant or your front office, and they say, here's your new patient. She left her last office because they said she needed a deep cleaning and she just wants a regular cleaning. And I talked to her about that, and we talked for 20 minutes on the phone about that. And so I want her to see the hygienist, and you know, it's just humility. And the worst business owners and the worst dentists are control freaks who don't let anybody talk. You can't deliver them any bad news. It's kind of like Saddam Hussein. no general could say, well, if you start a war with America, they're going to kill you in 100 hours. If you said that, he'd kill you. He wanted to hear that we're going to kick their butt. And what did it cost him? His life. So yes.
You know, Howard, being from another country gave me a lot of that humility to come to America and from a doctor become assistant. Made me reevaluate a lot of things in my life. And I'm going to tell you that you're always going to find people that are more difficult to work and the others that are easier. But it's important to also we give a chance and really try to understand what's behind that control, is behind that micromanagement. I believe that when we talk and we have opportunity to know each other better, this can end up going away. I am a hygienist that when I go to a dental office, I am straightforward about the type of office I want to work, the type of doctor that I want to work, and the type of person that I am. I tell, if you want your hygienist to be a machine, be quiet, it's not for me. Because I do like to interact, I do like to give my opinion. But sometimes I feel that some people are not prepared for that. Some doctors may not be prepared for that. And the most important thing for it, I believe, open your mind and you see that there's more beyond you is going to, for example, to Dental Town. You know, like if you go to the forums of Dental Town, you can meet a lot of professionals that can give you some tips. Hey, I did that with my hygienist and increase my communication. The other can say, I did the other thing, but also be prepared yourself. Sometimes I believe doctors can have some insecurity because they may don't have that communication so into their soul, let's say. So, you know, take classes. I saw other day Janie Butler, I think, is speaking with you about stress management. Awesome. I was like, wow. Because, you know, taking some extra classes, continue education, hire a dental consultant that can give you some tips on how to communicate with your team. And I tell the hygienist the same, you know, maybe if you have more knowledge, you're going to feel more secure to address problems with your doctor. I tell, go to Hygiene Town. There's the perio reports that you guys do every week, every session, every edition. It's awesome. Go to continuing education. Prepare yourself more as a professional so you can talk with the doctor in the same level and be able to have that open conversation that you will, in the end, improve your dental office, your team.
So you said you like numbers because numbers don't lie. Talk about numbers. Like when you go into a dental office, like say I was bringing you in to consult in my office. What reports would you want to see before you came in the office? What numbers do you look at? What do you try to do?
Yes, I believe that for we improve as a person, that should be me or you, we need to know where we are right now. So, for example, I talk about dental consultant and I talk about people having consultants and help to move forward. I tell that because I do have my business coach. I do have my English coach. I'm trying to lower my accent, Howard, to believe I've been working so hard on that. But before I start that, I need to know where I am. So I need to have tests to know which level I am to be able to improve. So in the dental office, the same thing. I always encourage doctors to pull up their reports and really know what's going on in their practice. You can do that from, I would say, any dental software if you have one, and I really recommend you have one that helps you a lot. And pull up reports from the last 30 to 60 days. And there's 3 reports that are very important, in my opinion. One, know your overall hygiene production. So let's say if you make $10,000 in a day, your office make $10,000 in a day. There's a benchmark that says that 33% should come from hygiene. So your hygienist, your department should produce 33%.
And would that be the office with one hygienist and one dentist?
Yes, exactly.
Okay.
If she's producing less than that, is missing opportunities to do the right thing on treating and diagnosing periodontal disease. Because A lot of hygienists doing prophylaxis all the time when we know the prophylaxis, the prophy, should be done in healthy patients. And that has nothing to do with the numbers, like 50% of the Americans over 30 years old have perio disease. So we cannot do prophylaxis in that patient. We're being neglected and we're being doing wrong to our patients' lives. So I would say that when you pull up the report, if you see that 33% of your production that they come from hygiene, you're in a good margin there. Your hygiene department is good. Another thing that you should look is how much your hygienist produce for you per day. So you can run a report and check their hourly rate, and then you can multiply by the numbers of hours and you have the daily production. There's an easy formula that if you guys want, you can contact me and I can give it to you, or I can talk right now if you prefer. Usually it's 3 times the hourly rate of the hygienist times 1.25. That 1.25 is the taxes and the fees that goes with the hygienist salary. So 3 times her hourly rate times 1.25. What we see as a good benchmark would be your hygienist producing at least $1,200 a day. Of course, Howard, depends on where you are located, where your office is. If you're in New York or you're in Florida, there's a big difference there in terms of fees and salaries also. So you need to be more flexible on that. But that's the benchmark there. And also, the third one that's extremely important is see how much of periodontal procedures, how much periotherapy are you doing? How much SRPs, perio maintenance, are you doing? So you can pull up reports which those codes, the hygiene codes like 4341, 4342, the SRP codes, or 4910, the maintenance code, and you can find a percent of the hygiene the hygienist is doing the periotherapy codes. Usually tell that if your hygienist is doing 40 to 60% in periotherapy codes, you're doing good. You are addressing periodontal disease in a serious matter in your office, and you're having profits. So it's not only about the numbers, Howard. The main thing for me is we cannot keep putting patients in our chair and asking them, so are you taking any medication? And the patient give you a list, and you don't connect the medication with what's happening in their mouth. That is, we need to stop. We need to start thinking more and really, oh, okay, he's taking antidepressant. We know that causes xerostomia. We know that xerostomia can cause problems in the mouth. So we need to start thinking, connect the dots. And then when you have that, then you're going to sit down the patient in your chair and you're going to take intraoral pictures. You're going to do the full mouth probings. There's no way you can see how the patient is doing, how your hygiene department is doing, if your hygienist don't have the probe in her hands. She need to have that. So once you have that, you can see that your patient maybe is not healthy. He's not just for prophylaxis. He is for something more. And then if you have opportunity to take continuing educations, go to Dental Town, Hygiene Town, you end up having on you a chance to educate the patient and convert the patient from a bloody prophy to a SRP to a periotherapy, and you're doing that to saving lives. We know already, we talk about how gum disease can influence the whole body, and we want our patients to have us like someone that's going to educate and provide the best service. So I can't stand those bloody prophies anymore.
So you've talked about a lot of numbers in the hygiene department. Are there any numbers you look at for non-hygiene departments, like for the dentist or office overhead, or any other numbers, collection policy, or?
Well, no, Howard, the numbers, I work a lot of the dental hygiene department, consulting more for hygiene department, but I can tell you If the hygiene department is not producing that 33%, she's not sending to you patients. She's not finding more work for the doctor. She's not referring patients to you. And that's extremely important for the overall production. And if you notice also, Howard, the hygienist is doing way more than 33% of your overall production. That means that your production as a doctor is lower. So that means that hygienist is not finding work for the doctor. That means that doing the periodic examination, just like, oh, you're fine, see you in 6 months. So that is not the right way to go.
So Dr. Karol, what would you say to a dentist if he says, well, I don't really have a perio program? And so he hired you to come in and set up a perio program in his office. Talk about how you would set up that perio program and what do you like to see?
Yes, I would say to you that it's very common, unfortunately. A perio program, it is doing the right thing for your patients and treating aggressively periodontal disease. And by the perio program, you're doing a lot of more profits for the dental office. First thing, Howard, about 97% of the offices in America are billing out procedures like prophylaxis. Just don't make sense. If 90% of our patients that sit down in our chair are for prophylaxis, so ECDC is Academy of General Dentistry line, because the numbers just don't match. Do you agree with me on that?
I do agree with you.
Yes. So I would say to you that it's important to put a protocol and systems in place. First thing, I will talk with the hygienist. I will observe one day or half day, observe how hygienist is doing. I will pull up your reports and know how much you are doing periotherapy codes. I see that if we see that she's not going well, I will have a talk first with the hygienist and try to understand why she's not doing a full mouth probing, why she's not taking intraoral pictures, why she's not educate the patient and make the patient understand the importance of his health and the connection with his mouth health, with his body health. A patient, Howard, they understand that will definitely accept treatment. And I tell that there's 3 big roadblocks that stop office from implementing a perio protocol. One is the team is not on the same page. So it's so embarrassing, but I gotta tell you, sometimes in a dental office, you walk in there and the manager tells, oh, we recommend that type of electric toothbrush, the type A. And then hygienists say, no, here we recommend the type B. And doctors say, use a regular brush. So it's like patient get confused. Do you think the patient will accept treatment? Of course not. And then the hygienist say, oh, I think you need a filling here in the number 30. And the doctor say, it's a crown. The manager say, let's just watch. I mean, patients don't accept treatment because they don't understand what's going on. So first, we need to be all on the same page. It's impossible also, a hygienist, number one, produce $800 a day, and the other hygienist produce $1,200. I mean, if they both work in the same dental office, what's missing for one? So everybody should be educated and be in the same page. Number one, that's a number one roadblock that I found for not having a perio protocol in place. Number 2 is time. I noticed that sometimes doctors don't give enough time for the hygienist. I'll tell, it is impossible. You check the blood pressure in the beginning of the appointment. You do a full mouth probings in the patient, take intraoral pictures, take the x-rays, full mouth series, and then you talk with the patient about what the patient have. And then you do the cleaning, and then doctor come in for an exam. You turn out, you gotta clean it up the room for your next patient. You need to write down your notes. Oh my God, if it's less than 1 hour, it is impossible. So sometimes the hygienist is not implementing a good periodontal protocol and is not paying attention what your office really needs because they don't have time. And the third, I will say that is communication and education. Because I came from Brazil and English is my second language, I learned that if I want to communicate well, I do need with my patients back in 2005, I need to have easy and simple terms to talk with the patient. I need to have the patient look at me in the eyes when I talk. I need to have ask the patients, do you understand what I said? Do you have questions? And we need to be a little detective and say, so tell me more here. You said your mother had diabetes. Can you tell me a little more about that? And communication, education is something that will improve every day. If you don't invest, if the team and the doctor don't make an investment in their hygienists, that protocol is not going to be implemented. And use the analogies. For example, Howard, sometimes I tell the patient, patients say, oh, I want a whitening. I want to have my teeth white like yours. I say, and I see that there's bleeding gums, there's bone loss, there's mobility. I tell them, look, imagine if you buy a house and you see that beautiful chandelier, or you see that TV or 6 inches, I don't know. I don't even know how many inches the big TV, but you see that you want something fancy for your house, but the foundation of your house is broke. How can you put that beautiful chandelier in a broke house? So I tell them that we need to start by taking care of the foundation of your mouth, that is your gums and your bones. Then once we make that stable, we can go to the next level and do your whitening. But you need to sometimes talk with the patient in which analogies they can understand. For example, I say, after all that investment of time and money that you did in your treatment here, which is in your perio treatment, you need to maintain, okay? So by saying that, I want to tell him that he needs to purchase the electric toothbrush that I have in my office. I'm telling him that he needs to purchase the rinse that I suggest. Otherwise, he's alone. He don't have what to do to maintain his good oral health in home. And then I tell them, imagine you buy a Lamborghini and you have the fancy car, but guess what? You don't put oil, you don't put gas, you don't take care of your car. The car is not gonna run in their full potential, right? They're like, oh yes. I said, because that is important. Is what I'm doing. I'm playing our team here like a soccer team. I'm doing my best, but you need to do your best in your home as well. So sometimes hygienists don't have that. And that's a big part of my consultant job. I really talk about communications and analogies that can really touch the patient and make them like, because of that, I need to fix this, and that. And make it personal. It's not about you, doctor. It's not about you, hygienist. It's about the patient. What is good there for them? Talk about them and, make it personal. Make them feel like you care. And if they feel like you care, they trust more, they refer more. And here you go. You're increasing your profits.
So a big question every dentist has. A lot of patients, Dr. Karol, call us up and say, I want to make an appointment to get my teeth clean. And we don't know who this person is from Adam. We don't know if they have perfect teeth or we just don't know. How do you schedule a new patient who just wants to come in and get their teeth cleaned?
Well, I would say in my experience, a new patient needs to have at least 90 minutes, 1 hour and a half. If you say, it's impossible, Karol, I don't want to give that time for a new patient, then I would tell you, you need to have in your schedule pre-blocks. What is pre-blocks? Let's say, Howard, you came into me and then I check you're thinking you're going to have a prophylaxis, a simple cleaning, get in, get out, but you have gum disease. You have periodontitis. So I will explain to you what you need, and by making personal to you, by taking my time, and once you accept the treatment, I need to have the time to start at least 1 quadrant, but I will never let you go without start something, okay? So we want the money there. This money is important for us also. So we're going to start 1 quadrant there. So I need to have that 90 minutes. If I have 1 hour and a half is enough for I do all collect all the data in x-rays, in the pictures and exam, and then I can start the treatment, the procedure. If I don't have, it's important to have some blocks in your schedule. A lot of offices are so busy that if I need like a SRP, I just can get in your schedule 2-3 weeks after. I mean, really, your hygienist spend more than 20 minutes telling how important it is, treating gum disease is serious, you cannot let it go. And then when you go to your schedule, you cannot schedule the patient because you don't have time. So I would say making 2 pre-box a day to start is a good thing. And or give your or hygienist the 90 minutes with the new patient. But time is important. There's no way that we can, do the right thing if we don't have the time.
You mentioned an electric toothbrush or a mouthwash. Are these part of your protocol? Do you
Definitely.
recommend electric over manual, and why
Yes.
is that? And mouthwash, go over that.
Yes, definitely. I think it's not only what you do there once you diagnose what the patient have. It's not only what you do as a procedure, but how you're gonna leave the patient alone without any support. No, he needs to have electric toothbrush, definitely. There's no doubt about that. Especially if he is not being very good at his oral hygiene. There's rinses, yes, that can help make it lower the level of inflammation in their gums. There's antibiotics that I would apply also in the office to help the patient. So all of these will help the patient to get a good and healthy stage and will increase the profits. One perio patient, Howard, is 3 times more valuable than one prophylaxis patient. Let me tell you why. A prophy patient comes to our office twice a year, every 6 months. A patient that has perio problems, he needs to be there every 3 months. So once your hygienist take the time and explain why it's important, the patient will be 4 times a year in your office. So here you go, you increase your profits already. Then you're gonna tell him that he cannot, once he invests all the time and money during the treatment, he needs certain tools that's gonna help them taking care of their gums in their house. So then you're gonna get from your closet that toothbrush as part of the package. You're gonna get the rinse. You're gonna get anything that that tongue cleaner, the tongue scraper that the patient needs, and that is part of your therapy. So you're not selling procedures. You actually recommend therapy. So what they need is like a whole therapy that includes your visit there, but also includes things that you need to use in home to be successful.
And give them name brands. So that you're mentioning electric toothbrushes and mouth rinses, but what brands have you grown
Come
up?
on, Howard, you're putting me in a situation here difficult now.
Is that not good? I mean,
well, no, I would say. Go ahead.
But you've thought about this a lot more than a lot of other people, so a lot of people would want your recommendation.
Well, I would say I work with the 3 main ones in the market, in my opinion, are Sonicare, Oral-B, and we have used to be Zilla, now is Dental Mat, that is the Rotodent. I think those are the 3 that I work and I can recommend. They're all equally good for the patients.
Rotodent is bought. You said Xyla bought Rotodent?
No, Xyla used to manufacture Rotodent.
Really?
Yes, but Xyla was bought by DentMat, I think DentMat, the name.
DentMat?
Yeah, they just
DentMat really?
Them. Yeah,
DentMat bought Xyla.
Yeah,
I did not know that. My buddy is the CEO there, Steve Semmelmeyer.
Yeah,
I didn't. Yeah. So they bought Xyla, which makes Rotodent.
Exactly.
And that's one of your 3 favorites, Rotodent?
Those are my 3 favorites: Sonicare, Oral-B, and Rotodent. I would say that if you have one of them, you're good. The patients will have a good care. Other thing, Howard, that we can, as part of my protocol, definitely oral cancer is screening in the patients. We can no longer put your tongue here in the gauze, look your right, look your left. No, please. We have other tools that they help us. We have Velscope, that's awesome. We have Identify, that's our other oral cancer screening system. We have Visilight. We have now the Oral ID is one that just came out. It's awesome. It's excellent.
Didn't Xyla have a light? What was Xyla's?
Xyla is Visilight, but now they incorporate Velscope also in their products. So
So Xyla got bought by Denmat, and
Yes.
Xyla had Visalite, and now they incorporated Velscope too?
Yes.
Those were two separate companies, and now they're all owned by Denmat?
Yes.
Huh.
Exactly.
I should get okay.
Yes. And now there's one new company. I don't know the owners. I know they're from Texas. Called Oral ID. Is a light system that help you with screening also for any abnormal lesion in your mouth of our patients. Also, we have the Identify. That's a very good also light system. So I'll tell you, part of my protocol is also tell the patient the importance of oral cancer screening, and that you charge extra, okay, for your patient. So you're gonna be making money also.
And what do you charge? And does insurance, like, does Delta Dental pay for these? Or?
No, majority of them don't. There's some insurance that do, majority don't. I can tell you here, Florida, okay, I don't know New York or Arizona, but I would say Florida is about, you can charge up to $60 for our oral cancer screening in your patient.
In Arizona, we don't do oral cancer screening because we're all going to die of skin cancer. So I probably got a melanoma on my head right now, and I'm not even aware. I want to ask you another thing about oral cancer. We're seeing an explosion of oral and pharyngeal cancer because of HPV.
Yes.
I think. Do you? What are your thoughts? Is it a dentist and is it a hygienist role, since we deal with oral and pharyngeal cancer, to talk to patients about HPV vaccines?
Yes.
Do you talk about this, or is that?
I do.
Yeah.
I think all the team should talk since they walk in the door. The front desk, office manager, doctors, and hygienists. But I take the responsibility. I don't mind. Bring it to me. I take it. I talk with them. I make comparisons, especially with women. I tell them oral cancer being increasing a lot in our country. One person die every hour from oral cancer. Okay. So that needs to be stopped. We cannot keep doing that. And then they look at me, they say, really, I never thought about. I said, yes. So we have here in our office a new technology that we can, by a light, a spectrum of light, we can diagnose any lesion that can be suspicious. Not necessarily cancer, I tell them, because they start freaking out. So I say, not necessarily cancer, but any abnormal cells that we can end up finding in your mouth. And then they tell me, that's not covered by your insurance, and the price is $50, for example. They like, oh, I don't want it. No. I say, look, you are a woman like me. We go every year to the gynecologist, and we do our pap smear, right? Yes. I will say, do you know what it is, the pap smear? And they like, well, no. I say, pap smear, the gynecologist removes some cells, and that she's gonna test those cells and see if there's any abnormal cells. What I'm doing is the same, but I will take the cells from your mouth, and we're gonna test and see if everything's okay. I would say, it's very important. If your gynecologist tell you that she's gonna charge you $30 to $50 to do the exam, would you say yes or no? Oh, no, yes, because that's important. Here's the same. We are here, we are healthcare providers, and it's the same. I'm telling you that we need to test for those to see if you're okay, or if you have abnormal cells that can lead to oral cancer, and that's the price. It's your health. So I think that's not even an option for you. Am I right? And then the patient say, yes, you're right. But if you just tell them, look, you need be tested for oral cancer, then you're not going to accept it. Of course not. But if you're a hygienist, take the time to explain why it's important. Compare, make analogies. The patient will say yes. So that is what I work a lot of when I go to the office consulting. I work a lot of in how to communicate to the patients, how educate the patient, and also how much this increase your profits. It's like it's night and day, Howard, I would tell you. There's no way that a team can work without having the right verbiage, the right information to give to our patients.
Karol, I'm a man, so I've never had a pap smear, but do they use those lights downstairs? I mean, some men have told me that Visalite and Velscope, a lot of this technology was all pioneered for women in a pap smear.
Exactly.
I mean, are they just taking a swab and put it on a petri dish out, or do they actually stain the tissue, look with a light,
I don't know all gynecologists. I can talk by mine. Might take a sample, of course, but also use the light.
So they are using the light down there.
Yes, down there. Yes.
Okay. Yeah.
my use.
Yeah. I've heard men say that, but then I'm always wondering. I'm pretty sure that man telling me he's never had a pap smear, but they.
Yeah, but if you have a male patient, you're gonna tell. You know how important it is, the prostate cancer, how prostate cancer being killing people. So, we need to do the same. We need to examine you to make sure that you don't have any problem. And we are healthcare providers. We are here to educate and to bring you back to health, to maintain your health.
And you know what? And there's no accountability either because there's a lot of girls in Phoenix who are having massive oral cancer at 22 years old that we're seeing every 6 months at a dentist, right here in my backyard. And no one ever said to the little girls and the mom and dad, have you considered getting an HPV vaccine for your daughter? And then at 22, the mom's livid that she's had a 6-month recall for the last 6 years. Nobody told her about this.
Yes.
And then the dentists are always telling me that, they get mad when people say, well, oh, you're a dentist, you're not a real doctor. And I always want to come back and say, well, your actions, you're not a real doctor. You're a molar mechanic because you had a little girl come in your office every 6 months for 15 years, and now she's dropping dead of oral cancer, and you never once mentioned the HPV vaccine. And then the state boards, I'm not even allowed to give the HPV vaccine, but a registered nurse can or a PA can, and my pharmacist can give you a flu vaccine. Yeah. It's very confusing, and we need to get dentists and hygienists need to become, like I say, it's like when I see a house on fire, every fireman's putting water on that house. Yeah. And I'm a healthcare provider, and I feel like 90% of my job is putting water on a fire from 2 gram-negative anaerobes, P. gingivalis and Streptococcus mutans, 2 bugs that can't live in oxygen. But this HPV virus is rearing its head. And I'm in a big town. I'm 10 minutes from Arizona State University, and there's a lot of oral cancer from ASU, and it's mostly girls.
Yes, I just knew that 2 weeks ago, a girl here in Florida, here in my city, in Fort Lauderdale, she passed from oral cancer. A young girl, 18, 19 years old. And yes, this cannot happen. And it's very important that we communicate. And if the doctor don't feel comfortable, the hygienist needs to say, it's on me. I need to talk. I mean, you cannot really pretend that's not there. You are a doctor, and you are as capable as a physician it is to help that person to understand their problems. And sometimes, Howard, the patient go more to us, to our dental office, then they go to their physicians. At least twice a year, we see them, and then we cannot close our eyes for that.
Karol, you know what it reminds me of? Since I'm 52 and I graduated in 87. In 87, everyone was embarrassed to talk about HIV because it was gay people, and homosexuality back then was in the closet. It didn't come out of the closet. It wasn't legalized, and people didn't want to mention. I remember they would. Older instructors would call it gay cancer. Wow. And now here I am, 52, 27 years later, and dentists and hygienists say, well, I'm not going to mention HPV. That comes from oral sex, and I can't say oral sex in front of a patient. And I'm like, if you can't say oral sex in front of a patient, you shouldn't be a doctor. I mean, it doesn't mean you condone it or you recommend it. I mean, you're a doctor, and this little girl is died of that because she caught HPV from oral sex at 19 years old, and you just saw her on 6-month recall since she was 2 years old.
That's sad. Yes,
it's very sad.
Yes, we need. Sometimes I tell if the hygienist don't feel secure or don't feel that she's capable to communicate, take continuing education classes, go to a seminar, just get more information. What more information you have, more security enable you feel to talk with other people. There's nothing to be embarrassing in talk about oral sex and how much this can cause problems like oral cancer because through the HPV virus. Embarrassing is you don't talk. Embarrassing those kids dying. So I would tell hygienists, doctors, assistants, we all need to be together to do the best we can for our patients' lives. And no doubt.
Yeah, and I want to end on this one note is that You know, if you could say anything good came out of AIDS, which is hard to say. I mean, that was one of the worst viruses that ever hit Earth. At least now, the entire planet knows that you can pass a sexually transmitted disease and die. Yes. The whole planet knows that. And condoms and abstinence are taking over, and we see HIV rates plummeting. But we still see mouth is like a totally different deal when there's no difference between a mouth and an STD. Yep. And you see, I can give you the names of 25 patients of mine that are just livid because they've been fighting 3-month recalls and perio disease their whole life. And no dentist ever said, well, yeah, but then you go home and kiss your husband, and he hasn't been seen by a dentist for 10 years. And then I get his husband in there, and he's got 3 molars rotted off to the gum line, 6 and 8 millimeter pockets, and a lingual tartar bridge. And she's saying, so you're saying that when I'm kissing him, that I'm getting gum disease from him? And it's like, well, you know, if he had gonorrhea, and you had gonorrhea, I can't give you penicillin every 6 months for the rest of your life. I got to treat your husband's gonorrhea. Exactly. Everybody knows that below the belt, but they don't understand it in the mouth. They're not talking about HPV. Yeah. They're not telling every single person with periodontal disease, I need to see who you're making out with. If you're kissing your husband and Frank's got a full mouth of this, I can't treat you without Frank. And so we got a long way to go. Hey, our hour is up. Man, that was a fast hour.
It was fun.
And thank you, Dr. Karol, for all that you do for dentistry, for your patients, and for all your posts on Dental Town. And thank you so much for sharing an hour with me today.
Yes, and Howard, you said about implement a perio protocol. If you go to my website, you can get a free first step that helps implement a periodontal protocol in your office. It's just the first step. It's going to take more than just download the protocol, but that will help you and your team start a communication.
And what is that website? www?
Karol, I don't know if there's a W actually. I always put directly. Karoline with K-A-R-O-L-I-N-E. Biami, B as boy, I-A-M-I, R-D-H, like registered dental hygienist, .com. There you can get a lot of good tips from me, and also you can have for free free offer of my periodontal protocol that you can download and start to talk with your team about gum disease, about oral cancer, and how can you make better for the health of your patient.
And Karol, I'd like to ask you a favor. We have a section on Dental Town called downloads. Like I have a lot of forms, speakers put up their seminar handouts or whatever. But if you, I wish you could also put that on Dental Town downloads. You could have your contact information too, but it'd be one more place where dentists could find you. Yes,
definitely. I will do that. And I want to tell just one thing, Howard. My first dental seminar ever here in America was Dental Town in 2008 in the Rio Hotel. And one day I was there. I was 3 years in America by the time. And I worked for a doctor in Arlington Heights, Illinois, Dr. Gilbert Mendes. That was a blessing in my life. And he always in Dental Town. He loved it. And he said, let's go the whole team, and he paid for everybody, and we went to Las Vegas. It was my first time in Las Vegas, and my first dental seminar here in America. I love it. I was like, wow, look how things are here in this country, and I never thought I would be here talking with you. So thank you for the opportunity, Howard.
Well, I'm going to put you on the spot. You got to come to a Dental Town meeting and actually speak next time you come.
I will. Next year, I want to be speaking there.
Next year, you're speaking. You already planned?
Let's do it.
All right, let's do it. Karoline, thank you so much for an amazing hour.
Thank you, Howard. Thank you.
Bye-bye.
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 Bye-bye.